Hello, my name is Ashley, this is Faithful Rattos, and welcome back. So today's video will probably be a little bit of a shorter one, but this was one that was requested over on Instagram in my DMs, I think, just in this past week, and I was talking about emergency vets at some point. I think I posted a reel about emergency vets, and so I had a message to ask me to make a video about when should you bring your rats to the emergency vets, and I think this is a really helpful video, and I'm surprised I haven't done it before. So that is what we're going to talk about today, and it should be relatively quick. So I have thought about all the different types of scenarios in which I have taken my rats to the emergency vet, and the scenarios in which I would take my rats to the emergency vet, and I've come up with like 5 categories of things that I deem emergency vet necessary. So the first one is wounds that do not stop bleeding. Now this is very serious, can be very serious. The wounds continue to bleed because rats are very small and they don't have very much blood within their bodies to lose. So if they have a large wound that will not stop bleeding, this is something that I will always go to the emergency vet for, and thankfully I haven't actually experienced this yet, so this isn't something I can speak on. In my logical part of my brain, I assume they would give the rats fluids, they would stitch it up, and they might even use some sort of wound clotting situation to help the wound stop bleeding. Now, something that may feel like it doesn't stop bleeding but is not an emergency is if you accidentally cut the quick. That might bleed for a long time. It's not very serious. Blood from cuts on the ears or the feet can look pretty severe, but they are also not that serious. I'm talking big gashes, open wounds, perhaps surgery sites that have been messed around with, where there is a lot of blood and it's continually bleeding. If there is a large wound and they're already on pain medication, oftentimes that is not an emergency situation and you can wait until the normal vets open, and often sometimes I will recommend this because I would rather you wait and take your rat to a rat savvy vet than go to an emergency vet that is not very well versed in rats. And this is something that a lot of people face, is that emergency vets, you can have the best day service vet that knows everything about rats, but it is more difficult to find an emergency vet that is rat savvy. So a lot of the times something can be serious but not emergency level, because it's much better just to get them seen once by somebody who knows what they're talking about than rush to the emergency vet who can't really help you. The second is kind of along the lines of the same thing, and that is major injuries where like organs are sticking out. So in the abdomen, this could be, like intestines, things like that, or if there has been a fight and there has been an injury to the testicle area and the testicle itself is coming out, that is an emergency. That needs to be stitched up immediately, otherwise you can deal with some very serious issues. So obviously those are emergency situations that I think most people would consider an emergency. What is an emergency when it comes to sort of wounds are tension slices. These heal extremely fast. They look horrific when they first happen, but in 12 to 24 hours they're already scabbed over and a long way into healing. So this is not something that you need to go to the emergency vet for, or even the regular vet for. They don't need stitches. They heal very, very well. So this is not something that I would go to the emergency vet for. The third thing that I would go to the emergency vet for is any sort of respiratory distress. Gasping, major side sucking. These things are very, very serious and often require oxygen therapy, at least to sort of bide some time to figure out what's going on. It could be heart problems, it could be pneumonia, respiratory problems, but it's something that is very serious and is not something that you should leave. In some cases, you will result in a decision for euthanasia, but this is very, very important because obviously breathing problems is very, very serious, not something to mess around with. I will say just be very careful because gasping and choking look similar to the untrained eye, so make sure you know how they look differently, because they do. Gasping is more like sort of motions, whereas choking is more like sort of motions. I'll try and put some videos on the screen if I can find them. But yeah, choking and gasping are different, and choking is not something I would rush to the emergency vet for, because if they're choking and they're breathing, they can clear it themselves. They may need to have a follow-up appointment, a non-urgent appointment, in the future, but it's not something that you would rush the vet for, because there's very little a vet can actually do in the case of choking, unless there's something going on like in the throat, like a tumor or something like that. However, gasping is very serious, and it can be a symptom of heart failure, it can be a symptom of pneumonia. So it really depends on the situation, but gasping is never good. Side sucking, all of those sort of respiratory distress symptoms, straight to the emergency vet. Then the fourth thing I would go straight to the emergency vet for is severe neurological symptoms, because this can be indicative of a stroke, and oftentimes these rats are way too far gone and they are not going to pull out of it, and they do require euthanasia. This is something that I will not let a rat suffer with overnight or over the weekend, because it's very distressing. They will unlikely be able to eat and drink, and this will cause them more problems. So this is something that is definitely a required emergency visit or an urgent visit, whether it's in the daytime. So this is something that I would never ignore. Oftentimes it is a stroke, and sadly, oftentimes they don't come back from severe neurological conditions, especially the sudden onset ones. And then the fifth kind of broad topic of times I would take my rat to the emergency vet is if they're actively dying. Now, this can look in many different context situations differently. If your rat had previous history of heart failure and they're slow, lethargic, not eating, not drinking, kind of heavy breathing, that would be sort of an actively dying situation. You could just have a very elderly rat that is on the brink, and this is just a really, really horrible time for them. Now, some people would argue that letting them go peacefully at home is better for them, and this is something that I do not argue for, because it can take them a long time to go. They can be in this actively dying state for a very long time, and it's not fair to them because they are going to be suffering in that situation. So that is one of the times when I would definitely be going straight to the vet, no matter the time of day. Actively dying, there can be different types of scenarios in which this is happening, but I would be trying to get to the vet in those situations, because they can hang on for a long time, and it's not nice for them. It's really, really unpleasant for them. And a peaceful death is much better. And that is really what euthanasia means. I can't remember the exact meanings, but it does come from the Greek meaning good death. So it is something that I would be going to the emergency vet for. And the last little bit of this video is really just talking about the context of the situation and making your own personal judgments, because each situation is going to be different. You may be very lucky to have a very rat-savvy emergency vet that you would more likely go to because they know what they're talking about. You may have a really awful emergency vet like me, who you've been to many times and they have done horrific things, or just not helped you, blackout, just flat out just let you wait in the waiting room for ages, like has happened to me in the past. So it really does depend on your context, how different types of scenarios that are on the sort of grey edge of this, whether I'd go to the emergency vet or not, just because I do find that oftentimes emergency vets are less rat savvy than your general practice vets, and you know which vets you trust, and they're often not the emergency ones. I am very lucky that one of my vets has an on-call service, but I only call her if I'm absolutely sure it's an emergency and it cannot wait. I have a handful of vets I can see during the week, so I will try and get in there. I do have another vet that is not super rat savvy, but it is open slightly later. So if I have an issue in the evenings, especially Friday evenings, which seems to happen a lot, I know I can go to them if it's just a simple put to sleep situation, because they are open slightly later than my rat savvy vets. Also, a lot of the times when you're at the emergency vets, you are going to be making quality of life decisions and euthanasia decisions, which is very sad, but oftentimes the best thing for the rat to not prolong any suffering. And now it really does depend on what the issue is and the sort of prospect of the treatment, but I have had many euthanasia at emergency vets because of the situations I've had. That is everything for this video. I hoped it was helpful to help you decide when is the right time to go to the emergency vet. And I will just say, if you are unsure, do go, but do take into consideration how well those vets are knowledgeable when it comes to rats. Okay, thanks so much for watching. I hope it was helpful. If you have any more comments or questions or concerns or critiques, do leave them down there in the comments down below. I am very excited to hear from you. If you made it all the way to this point in the video, leave me the sparkle emoji in your comment. And yeah, if you want to become a channel member, you can. I have, hopefully, babies coming soon. And if you're a channel member, you will see them first. You will be able to help me name them if you are on the highest tier. So yeah, do check that out if you're interested, and I will see you in the next video. Bye!